Today's material is a little less interactive, so we will not have breakouts today, but we will have opportunities for you to ask questions. So we're going to do a Q&A after each section, FMLA, ADA, that so on and so forth. So we'll pause. Now, to ask questions, so that we can keep it from being a free-for-all, we invite you to chat your questions. You're welcome to chat your questions as they're coming to you during that section, but we will not be pausing to answer your question in the moment. We will answer the questions at the end of each section for two reasons. We might already answer the question a little bit later in the presentation. And then also that gives Armand and others that are screening the questions an opportunity to kind of determine the priority, which ones we're going to address first. Okay. Any other logistical items? No, we can see you. So thank you for having your cameras unmuted. It's great. Your presenters, what you can't see is the fact that it looks like we're in a room with people, but we're not. There's just 6 of us here and we're pretending like we're presenting to a room, but it's just all of you out there virtually. So it's nice to see your faces on a TV. We appreciate you being here. All right, great. So we're going to continue forward. I'm going to turn the time over to Armand to set the stage and then we'll continue forward.
Okay, well, set the stage is right, because I'm not going to actually be on the stage for most of this. So what we just wanted to talk about is just what we're going to address today. So we're going to be talking about kind of avoiding medical mayhem, is I think what we've entitled this. And the thing that I'd like to just start with and maybe give you a little perspective on is I've been personally dealing in human resources and dealing with these kinds of medical issues for something north of 25 years. And so I think I can probably claim to be a little bit of an expert on these issues. That being said, though, I want you to understand how important the material you're about to get from Diane and Mark is, because when my staff, and I have a staff of HR specialists and HR analysts, when my staff have medical issues, I don't navigate them. I follow the exact same processes that Mark and Diane are going to talk about to you today. Even though I've been doing this for north of 25 years, I am not allowed to do any of the things that they're going to tell you you're not allowed to do as a supervisor, because it's not my role. I'm not their HR specialist. I'm not their HR representative. We have someone assigned to us. And so I follow this exact same process that they're going to talk about for you. So it has nothing to do with your knowledge, with your understanding, with your capacity, your capability. This is just the process that we do to make sure that employees get what they need, that their information is properly protected, and that everybody is safe in how we navigate these things. So we're going to spend some time talking about the Family and Medical Leave Act. Diane's going to run us through that. Mark will then take over and talk to us about the Americans with Disabilities Act and how we navigate those. And then, assuming we still have some time there, we're going to spend a little bit of time talking about long-term disability and drug screening. And we'll see just how far we get there. But we've tried to pare this down to just the things that you really do need to know, the key elements that are important for you to follow, so that when these things happen, and if you spend any time in leadership, they are going to happen, you'll know what to do, who to contact, and how to navigate these issues. So Diane, with that, we'll let you go over to Family and Medical Leave Act.
Thank you. All right, good afternoon. It's my honor to be with you today and talk about the Family and Medical Leave Act. And let's see what screen you're looking at. We'll take a minute to talk about the definition of Family and Medical Leave Act. This is protected time for employees to take unpaid time off to care for their medical needs. Is it too slow?
No.
Okay. I got you. Okay, I'm sorry. So to be eligible to enjoy this benefit, you need to be a full-time employee working for the state for at least 1 year. You need to have worked 1,250 hours within that last 12 months prior to taking FMLA. Also, immediately preceding that time is what the law states. It's immediately preceding when you ask for FMLA, but actually it is immediately preceding the time that you need to take for FMLA. What are the qualifying events? So a qualifying event would be giving birth to a child, or would be caring for a child, or placement of a child for foster care or adoption. It would be caring for your own medical condition. It would be caring for a parent or a child or a spouse. There are also medical leave benefits for military needs, but unless there is some specific situation, we haven't dealt much with that at DWS, that would be something you'd want to contact HR for. Okay, so is this paid or unpaid leave? Well, it's unpaid leave according to the law. In order for an employee to be paid, they would need to use their own leave bank time. And there are specific codes for that. Employees must complete a time card. That's their requirement. And supervisors, it's very critical that you ensure that how they have coded their time is proper in ESS before you approve of that time. Okay.
Make an adjustment.
What? It's not required that they take FML leave. So this is not a requirement. It's their choice. It's always their choice. It's protected time. So we strongly encourage that if it's a qualifying event that they use FMLA. Do they need to notify their supervisor and ask permission? No, they do not need to do that. That's not required at all. But it is required that you do let people know that, let your people know that if they have an FMLA need, that they need to contact HR. They should never disclose a medical need to their supervisors. And I know you guys are friends and colleagues and work together and build strong relationships, and that's what this is all about. So they'll often tell you what's going on for them with their medical conditions. But please do your best to just stop that conversation and send them straight to HR.
Can we pause for 1 second while we switch interpreters really quick?
Absolutely.
Thank you. I'll give everybody a chance to find me there on the screen.
We're pausing for a moment, switch interpreters.
Switching to Clay, right?
Yes, sir.
Okay.
Okay.
All right, I think you guys are good to go. Go ahead.
Thank you. Question we've often been asked is, does FMLA affect your benefits? Well, the state continues to pay for its portion of the benefits, but employees need to pay for their portion. So this includes dental, life insurance, and health insurance. Part-time FMLA. So part-time FMLA is granted as intermittent to FMLA according to what the medical provider might tell us that the employee needs. It could be a reduced work schedule, but we base our approval on exactly what the medical provider tells us the employee would need. When they return to work from full-time FMLA, they need to provide you and HR with a release to return to work. Oftentimes that might give information about maybe some restrictions. And if someone is on a part-time schedule, as they return from full-time FMLA, they will still use FMLA codes for their time. So an employee may give a certification to a manager, but that needs to come straight to HR. You'll need to delete whatever they provide to you as you send it to HR. The forms are all available on the employee gateway. They're available for Mark and I, or the employee portal under HR forms. We're going to change topics for a second. It's still leave-based. Personal medical leave information. Personal medical leave provides employees with a limited amount of unpaid leave when FMLA is not available, or the person's not eligible for FMLA, or FMLA is exhausted. Personal medical leave cannot be used intermittently. It has to be used on a full-time basis. And forms are only available through HR. Next topic, postpartum recovery leave and parental leave. And you're so excited about both of these. They're brand new, fairly new. Hey, you beat me. Eligible employees recovering from childbirth are entitled to postpartum recovery leave. And this is for a woman who delivers a child. It's 3 work weeks or 120 hours of paid leave. This leave does not come from the employee's leave bank, strictly comes from the state. It has to be taken immediately after birth of the child, and it may not be taken intermittently. Has to be approved by HR. And one of our responsibilities is to let the ERIC know there's been a delivery of a child, and then the ERIC needs to transfer the postpartum delivery leave time into that employee's leave bank. So it's very important that we know the date of birth. Parental leave, this only starts July the 1st. However, it is effective for 6 months after the birth of a child. It can be taken intermittently, but it is 3 weeks, up to 120 hours of paid leave. This is for any parent. This is for father, a mother, it's for any parent. Parental and postpartum recovery leave, they can run concurrently with FMLA, but they are not the same as FMLA. And communication regarding this leave will be handled, the FMLA leave will be handled separately. I'm excited about your questions for this. Here are the time codes. So I'll give you a minute to look at those. They're new, some are new. Your job is really important in making sure that the employee codes their time properly, making sure they put in the correct lead codes.
No, they don't have to memorize these, right?
Please don't memorize these.
You guys will
Can.
provide them to them.
Yes,
if
they will.
need it, right?
They're in the approval emails that we send out, and anytime you have a question, give us a call. So now I'm going to talk about the 18-week rule. So when DWS looks back at a person's leave for 2 years, FMLA time is federally protected time and is not counted in the 18-week rule. The 18-week rule is a rolling time frame for every employee. So we're checking to see how much time an employee may have entered that's not protected and counts against them as the 18-week rule. And DWS has the fairly consistent process and policy of termination of employment after a person reaches the end of that 18-week rule. So here's the key to all of this: contact HR when you have questions. So are we going to take questions now?
Yeah, so
We've kind of taken care of some of those, but I'm gonna let you go for some of these. So,
before you ask the question, Armin, so I failed to mention one quick housekeeping. So as a reminder, if you're having questions throughout a particular section, so for instance, the FMLA piece that Diane just covered, feel free to chat your questions as they come up. Armin's going to field them. If it's one that's specifically, it's unique to you, maybe he'll take you offline and answer that. Otherwise, he'll bring it up here for him and his team to answer. If you're having technical issues, your name is showing, Daniel, right?
yes.
Yeah, so chat Daniel or Mariah if you have technical issues for something, okay? All right, what's first?
Rock and roll.
Okay, does an employee have to pay for their portion of the benefits when they are approved for intermittent FMLA?
They need to at least enter enough paid time to cover their deductions, their benefits. So if their intermittent leave is days at a time, as long as they're entering enough work hours or leave bank hours, they're covered, and their portion is covered as well. The state will always cover its portion. Does that answer that question?
How does a supervisor know to determine what their portion is? Is that something you help them
Through
with?
HR.
They can contact us and we can help them get a number for that. Can parental leave and postpartum leave be used for adopting a child?
Only the parental leave, not postpartum leave, because no one involved in that situation has given birth. The employee that gets the postpartum recovery leave is a female delivering a child working for the state. That's the bottom line.
Actually, so Taisha Larson asked a question here, and I'm not sure I understand the full question. So Taisha, if you could come off mute really quickly. The question was, can parental leave be used for all children or just when a baby is born? And I'm not sure I understood the question.
6 months.
So what I was meaning by that is the parental leave, like, can you use it for other situations regarding like childcare for like any of your children, or does it have to be a newborn baby, like directly after they're born?
Thank you for clarifying. You can only use that parental leave within the first 6 months of the life of the baby that's born,
Right, so,
and for no other reason. It's,
well, adoption, foster care.
well, I'm sorry, that's true. Adoption, foster care. So not for,
So
Not for
birth,
daycare.
adoption, foster care.
Correct.
But
It's not for general childcare issues.
Okay, great, good question.
any others?
Yeah. Can the employee receive both postpartum and parental leave for a total of 6 weeks?
Yes, that answer is easy, and it's yes.
Is the 18-week rule a federal rule or a state rule?
It's DHRM rule. I'm sorry to interrupt.
No, it's okay.
So it's a state rule, it's a DHRM rule.
If a worker is missing a lot of work due to medical issues and is not on FMLA, do they risk violating any potential absenteeism policy?
The easy answer is yes, but I'll combine that with contact HR as soon as that starts to happen. If you start to see a pattern of time being missed, then contact HR as soon as possible. You may not speak with your employees about their medical concerns, but we certainly can. We can look into what's going on, find out details, and if they need our assistance with forms or understanding laws, rules, policy, we're happy to share that with them. So that's the answer.
Is there a way to shorten the 18-week rule with DHRM?
The answer to that would be, there might possibly be, but that would have to be a question that was raised by your management and probably EDO, worked with Armand, to then speak with division director, our division director in DGO, right? For a policy exception.
I will say that is a topic that gets discussed when we discuss DHRM rules pretty much every year. So if you have an opinion on that, if you'd like to weigh in, I'd love to hear it.
Yeah.
You getting others?
Yeah.
Okay.
Is the parental leave a DHRM statewide benefit, or is it the additional 3 weeks DWS granted after the legislature approved the postpartum leave?
The parental leave was granted by the legislature in the last session, so it's law. It goes into effect July 1st, 2022.
Yeah, so I think what's being asked there though, Derek, the parental leave that we're talking about today replaces the leave that DWS has been providing over the course of this last year. We knew that when postpartum leave was passed last year, we knew that parental leave was coming. In fact, we were surprised that it didn't happen when during that session. And Casey wanted to address that issue sooner. So Casey approved the use of administrative leave to address that until the legislature this year revisited the question and passed the law. So this will now be parental leave and postpartum leave as passed by the legislature, and that will be the 6 weeks that we look at going forward.
Anything else?
That's the last one.
All right, Mark, you're up.
If you end up having another FMLA related question, you can throw it in the chat. We'll either address it at the very end, or we might have to take it offline and send out. I mean, you can speak. I don't have you speak this, Mark, but we're going to create an FAQ some sort of handout that we'll send in afterwards with a lot of these, the answers to a lot of these questions.
The FAQ is call Diana. That seems to be the ongoing mantra we want to be able to have is call HR, call HR. If you have a question, call HR. But I have this medical note, call HR, and that will be able to help a lot. But we wanted to give between these FMLA, ADA, and these other topics, we wanted to give you kind of an overview of what is the most important thing that you as a supervisor should be involved with, should be recognizing and saying, hey, we may have a solution for that. But the idea is that this training is not, and we designed it specifically with this conversation in mind, is not meant to make you experts at all in any of these rules, but just give you some of the specifics that have to do with you specifically as a supervisor. So that's what we're trying to do. So what Diane just got through talking about, the Family and Medical Leave Act, was what is a right the employees have to miss work. And so that's what the leave talked about is if I can't do my job and I can't come to work, what protects my job? And that's what that's what the Family Medical Leave Act does. Americans with Disabilities Act is very distinctly different than FMLA because it says when an employee is at work, what are some of the things that we can do to provide to that employee to help them to do their job. So it's not, FMLA is when they can't do their job, ADA is to help them do their job. And that's the specific difference between the two. So let's talk a little bit about what ADA is. And it's really, it prevents discrimination based on a person's disability, both in hiring practices and normal ongoing employment practices. So that's what it is. It's an anti-discrimination law. A disability is an impairment that substantially limits one major life activity. And there's been some amendments to the Americans with Disabilities Act that have helped to clarify and actually broaden what those disabilities are. So it's a pretty broad spectrum of what is considered a disability. And again, that's where HR gets involved and even consults with legal to determine what things are disabilities. It can be episodic, so it could be something where a situation occurs at times, but not all the time. Well, that could also be considered a disability. Yeah, and again, like I said, it's a very broad definition. So how is a disability determined? Well, there's a couple of different ways. One, there's just some obvious issues where somebody's in a wheelchair, somebody's blind or visually impaired, they're deaf or hard of hearing. Those are kind of obvious things that we don't need to get medical documentation necessarily to understand that there's a disability. But there's another process, obviously, if we don't see that as blatant, and that's through a medical certification. So an employee would contact us. So again, you direct the employee to Diane or I. They would then send them a form that then helps work with their doctor to determine if there is a qualified disability, and then what any kind of reasonable accommodation would be suggested. So, how do I know if somebody has a disability? Call HR, right? That seems, again, that's our mantra, call HR. We don't expect you to know whether they have a disability or even ever ask, well, hey, do you have a disability that we want to take care of? You just say, hey, if you have a disability, or if there's an issue that you may be concerned with, then contact HR. We send in the intake form, and that's a conversation between the doctor and the employee, because the doctor knows the condition, knows how the condition can be remedied, and then the employee knows the job. And so it's a conversation initially that the doctor and the employee has to say, here's my job, you know the condition, what are some of the things that might be a solution or an accommodation to figure that out. So then that's sent back to the HR department, and we take that from that point going forward. So how is a disability determined? It's the existence of a disability does not necessarily mean that they have everything needs to change for them, that existence of disability does not necessarily mean that anything needs to change for the employee. Just because they have that disability, we don't have to push them into anything. If they can do the job, they can do the job. So never assume that there's a disability, even if it looks obvious to you. Again, we're going to bring that back to HR as we need to. So what is an accommodation? An accommodation is provided to an employee that allows them to do the job the same as any person with or without a disability. So we're not going to change the job, we're going to change the process or the underlying parts of the job that allows them to do the job as if they didn't have a disability. That's what really an accommodation is for. So it must be, an accommodation must be reasonable. Again, allows the employee to do the job. It does not require an employee to do any of these. It does not require the employee to eliminate essential job functions. So that's why job descriptions are important to us, because it lists in there what some of the essential functions are of the job. So if it's an essential function, the employer does not have to remove that. It doesn't have to impact or lower quantity or quality. So we don't have to say, well, as an accommodation, we're going to have you take fewer cases, or we're going to allow you to do a lesser quality standard. Those are things that are not considered a reasonable accommodation. Nor does the employer have to create a job or move an existing employee to that job, to somebody else's job. So there are a lot of things that are not considered as reasonable that we would talk with, and that's where me and the agency, Diane and I and the agency management would get together to discuss what kinds of accommodations are reasonable, what things are not reasonable. So we want to fall within those same criteria. So we're good? Okay. So what if an accommodation is not reasonable? What do we do then? Well, a lot of times what happens is as we're talking with the management, then one of the things we do is say, well, we can do this instead, or here's another option. I wonder if they thought about that, or hey, in the past, we've done this with other types of employees. So maybe this is an option, right? We can go back to the employee and say, hey, here's a suggestion from the employer, or can you go back and talk to your doctor about some of the other kinds of accommodations that might be acceptable with your current diagnosis. The important part that's mandated by the Americans with Disabilities Act is what's called help me out, Diane. An interactive process. Thank you. Helps me with, we have to have an interactive process. So we never want to stop the conversation, right? So if there's a question about an accommodation, then I can reach out to the employee. And these are always conversations that I'm having with the employer or I'm having with the employee, so that I kind of become this intermediary so we don't share medical information. So we can have those kind of conversations and try to come up with what both works accommodation-wise for the employer and for the employee.
Let's pause real quick to switch interpreters, please.
You got it.
Okay.
You ready? Okay.
Okay.
So how do I know the results of the accommodation? You say it could change through the process. Well, what we'll do is we'll fill out a form, or we'll create a letter that says, here's the accommodation that's been provided. We also may say, hey, this accommodation was requested, but we changed it, or we're not providing that accommodation. So we always make sure that we communicate back to the employee. Now, there's been a lot of, before we would deny any kind of a accommodation, there's been a lot of conversation that goes on between our risk department, our legal department, the AG's office, management, the employee, all those people are involved. And so when we send that out, it's really not a surprise to anybody. We're just informing, really making it official and informing the supervisors. And a lot of times what happens is that I'll get a call from a supervisor saying, can you help me to understand exactly what you wrote? That's a great question. Very, very common. Please don't hesitate to ever call us and say, hey, help me to understand what that exactly means for me. So always give us a call if we need to. So what's the supervisor's responsibility? Always suggest employee contact HR if they sense something may be needed. One of the conversations, and I actually had this conversation today, somebody said in a response to discipline, somebody said, well, I need to reach out to the ADA coordinator. Well, I don't think anybody on this call or this Zoom meeting has ever referred to me as an ADA coordinator, right? But that's what I am. And the way they got that is because we actually put that in our written warnings, our written reprimands, and our, anything we do with discipline, so that if somebody is receiving some kind of corrective action, that they would come to us to say, without you having to say, if you have, if you've got a medical issue, go to HR. It's right there in the form, so it's suggesting that they do that. And so that would then prompt them to give us a call so that we could help them through that process. Never ask for medical documentation, and Diane mentioned that as well. We want that to come right to us. If you get any, if it's emailed to you, delete that email, get it sent to us, we'll take care of it. Always show kindness and empathy. And I think Nate mentioned that in his introduction. We want to make sure that we have a lot of empathy and kindness, and make sure that we're doing what we can to best help that employee. Never offer an unofficial accommodation. This is a big deal. We have this often, we've heard of these situations oftentimes where a supervisor, in trying to show that kindness and empathy, go a little bit overboard, and they make an unofficial accommodation, which can be very problematic when we try to say, oh no, we can't offer that accommodation through the actual process. We can't offer that accommodation. And they say, well, wait a minute, I've been doing that for 3 weeks, or my coworker over here has not been doing that for 6 months. And so that really then obviously says, I guess we can eliminate that essential function. So it becomes very problematic if we have supervisors that are changing the job to accommodate somebody's performance, somebody's perceived disability. So please never do that. Okay, always hold employees accountable to job performance and expectations. Always do that. That's your expectation as a supervisor. Never ask if they have mental or physical problems. Always make factual performance notes in UPM. Great place to do it. Never enter any medical information in UPM. Okay. The one thing that you could put in the UPM is say, I directed this employee to contact HR if they feel like there's any need for that. Okay, that's okay to put into HR or into UPM. No other kind of medical documentation, no other kind of medical, even dialogue or discussion in UPM.
So we're gonna do Q&A.
Okay, so Mr. Drummond, do you have any questions, or did I nail everything perfectly?
Can you give an example of an accommodation a supervisor has done in the past that was unofficial?
Don't take phone calls, voice calls. We'll just put you all on chats. We'll have you do chat only. We won't have you do voice calls.
Does the interactive process involve direct supervision, or is that handled at higher levels?
The interactive process is actually done through me. I can have that interactive process with both the management and also with the employee. So I'm the kind of the in-between. Diane and I are the in-between with the interactive process. And it's specifically directed to the employee asking for the accommodation. That's where that's really important and looked at from an ADA perspective.
Do we have a definition of reasonable timeliness in providing an accommodation that employees can know?
There's nothing that's really set that I know of. Maybe Armin, if you know of anything that gives us some time frame, it's got to be reasonable. And that always seems to be the answer when it comes to ADA is what's reasonable.
I think the answer there is going to be no, there is not a standard that we can simply provide. It's going to be fact specific. It's going to depend on how quickly the employee gets us the medical documentation that's necessary and what it is they're asking for and how complicated it might be to get that stuff and install it. So there is not a time specific that we can say within a certain amount of time, you will have an answer. But if an employee felt like it was taking too long, we would want them to let us know that, and we can help them understand where we're at and what the process is going to be going forward.
And that happens quite often where, you know, it's a delay at some point along the way. And I know that Diane and I, we keep logs on people that have requested ADA accommodations, and we go out and check every now and then just to make sure that we're up to date on that, or we can go and see where we stand with any other concerns. So we can keep that process going.
In UPM, can you narrate about having a conversation with the employee about proper ways to call in when they're on FMLA?
What we do in the letter that's sent out with regards to approval for FMLA, right? Because that's where we've now switched to one FMLA question.
Yeah,
right?
or ADA.
Okay. We put in that letter, and we could say that the same thing, the same issue is with ADA, is that you have to follow the same call-in procedures, whether you're on FMLA or not. The same would be with an ADA accommodation. It would be noted specifically in the ADA accommodation response as to how we would deal if we're gonna, you know, the accommodation has something to do with timeliness of showing up for work, then we would put that specifically in, address that in the response letter. And if there is no response, if there's nothing in there, then that's not an accommodation. Being late, unless it's specifically addressed in the accommodation, is not in and of itself an accommodation.
Can you note in UPM that an individual is on FMLA leave or time off or an ADA accommodation?
You can put the facts in there. You know, a lot of these chat questions, there's something going on underneath there, right? That I would say that to me is one of those things that Lance talked about earlier that says there's something going on there that's generating that question. Please contact Diane and I to let us deal with that specifically, because there's something else kind of going there.
I think a good general answer to that, though, would be no. Don't note that. If you need to note something, you can note that they are on an approved leave, but you should not mention that it's an accommodation, that it's FMLA, or what that specific reason is.
You have documentation that they're on FMLA or an ADA accommodation because we've sent you that email. So that would be where you'd want to be able to keep that documentation.
This is going to be similar, but a little different. Is it okay? Let Diane answer this one because this was for her stuff.
What?
Come on up, Diane.
Yeah, that's right. Tag team.
Is it okay to mention, again in UPM, if someone is going on postpartum leave or is on postpartum leave, to address why they are absent for several weeks?
And you're putting that in UPM?
Yeah.
First, I don't understand the need to put that in UPM other than using the words approved leave. So.
And I would say, again, you have an email that states that that employee is on that leave and that they've been approved for that time frame.
Right.
So I'm not sure, again, this, you know, if there's some follow-up conversation we need to have there, you know, what's the point of doing that? Because you have documentation that would certainly show that they're on that extended leave.
We would have to know the why you need to put that in UPM before
Right.
we could really give a qualified answer.
Right.
Other questions we've already asked and answered, but if you feel like there was a nuance there, please let us know.
Okay. I'm going to turn the time back over to Diane.
Back it up.
Me?
Yeah, just
Oh.
because for you, it's. One more. Okay, great.
Oh, I see where you're saying. Looking at this screen, going,
Yeah.
it's
I know.
not
We're-
moving.
We're not seeing it. That's great.
Okay, we're gonna talk about long-term disability. And here's what you get to know. Long-term disability leave is a safety net designed to replace an employee's income should he or she become disabled and unable to work. So here's what I like employees to do when they know they're about to miss time for quite a length of time. Contact me and definitely take me serious when I tell you to contact PEHP Ltd and get a hold of them and start your claim, because they can always decide they want to decline an LTD claim or an approval, but it does take PEHP three months to make their decision. This is a state employed or state paid for benefit. Any questions about LTD?
We'll pause for a moment. See if any questions come in. Nothing.
Me neither.
Want to sing us a song?
Yeah.
I don't. that would be
Okay,
a
if
good
something
idea.
comes up about long-term disability, just go ahead and throw it in the chat. We can catch it. Yeah.
Okay, we found one.
Oh, good.
Talk about it.
Popped up. Great.
Well, so the question is, for LTD, if someone keeps working, does the 90 days start over?
That's a good question for LTD to answer. They take their medical documentation, they sort through it, they get all of their paperwork in order before they ever make a decision. So it just depends.
I
It's
think
case
that's
dependent.
that's the really key element. We're not wanting to be flippant here. We're not
No.
trying to avoid the question, but the reality is,
Switching
Hold on one second.
interpreters?
I'm going to switch interpreters to Clay.
Yeah.
Okay, hold on a second. Ready?
Let's see. I think maybe I missed the note. Something about the pins were lost.
Yeah,
Yeah, give us a second.
They're working on that right now, Paul.
Okay, so I'll still be the interpreter.
Cat that the interpreter's going to. Is the interpreter going to Clay?
Not until, no, it'll still be on me for a little while.
Okay, great. So we just chat that Paul is the interpreter.
Okay, so yeah, so Pamela is saying that she can only pin one interpreter now instead of two.
That's unfortunate. It's fixed. It is fixed, I hear.
Try again, it should be fixed.
Okay, so she said it's good now.
Okay.
Okay.
Any other lovely questions about LTD?
Well, so I just want to make sure that we hit this really quickly. We're not wanting to avoid questions on long-term disability. The reality is we aren't allowed to answer a lot of questions about long-term disability because we aren't involved in that process. We don't help them determine eligibility. We don't gather their documents. We don't process their rules. And so the really important thing is to understand that the benefit exists and that there is a process in place, and we need the employees to jump on that process as quickly as possible, because if they don't, they run the risk of being significantly delayed. There are, just like with anything, there are rules and standards that PEHP will decide when they're determining if a person is going to be approved and by how much, and how much of the waiting period they have used. And we have no idea how they even go through that process.
I think HR is a good contact as a resource if that employee has questions about what's going on with my LTD item. We can find out who's handling their claim and get that phone number to the employee. But aside from
Yeah, we
that,
can help them connect. but
that's right.
Yeah.
That's not quite what I said, I guess.
you're
All
right.
right. So you.
Okay, I'm gonna jump in, Mark.
Okay.
Just for, you can stay here. So we've got just about 30 minutes left, if we even need that. I don't even know if we'll need that. We're just gonna give you like 2 minutes before we
wrap this up with our last section. If you need to stand up and stretch, I don't know, anything, but we'll just pause for just 2 minutes so you can have a second to stretch or grab a glass of water or run to the bathroom. 2 minutes is maybe not long enough, maybe 3 or 4 minutes. How's that?
FMLA or
All right, we'll give you about 30 seconds. Mark will come up. We're going to jump back in for reasonable suspicion, drug testing. And then we'll have one final opportunity to ask really questions related to this section or any final questions. So if anything has come up about any of the other topics, feel free to throw them in the chat. Armin he's screening those, and we'll do one more final Q&A.
all right, reasonable suspicion drug testing. What a fun subject. There's really two things that we want to be able to get across based on conversations and questions that have come into our office about drug testing. So the rule 477.14 is the one that drives and governs the idea around reasonable or a drug-free workplace. So who's keeping up with this?
That's me. If you click, then I know where you are. So
Okay,
I'm good. We're there.
we're there.
Yeah.
We're good. You know, one of the things that Diane and I were just talking about is how many thousands of people we presented in front of, but this one is me and a camera. I tell you, folks, this is a completely different thing. So we appreciate your patience with us on working through this, and hopefully we're getting the message across, which is most important, right? So when can a test be requested? And first of all, there's actually a form that we use, and it lists a whole bunch of observable behavior. Number one is appearance, and speech, awareness, motor skills, and other types of behavior concerns. And then, so we want you to fill out this form and answer those questions. And then we'd ask that somebody else, you ask somebody else in your office to see if they can observe the same type of behavior, see if you see that's the issue. And if so, then that's when you'd contact HR, and we could go ahead and start to examine the idea behind whether we want to test somebody or not. So, which one am I controlling? Let's get.
You're controlling that one. I've got this one.
You're controlling.
Yeah.
this
one. To jump into
Perfect. No, you're good. You're good.
Go there.
Yeah, right there.
Yep.
So I think, are we on the same page?
Mm-hmm.
Okay, perfect. So what's the function of the rule? One is it allows the use and possession of legally prescribed or over-the-counter type medications, including medical cannabis. So this is a question that I get on a fairly common basis, where somebody says, well, hey, I'm looking at going to my doctor and wondering if how medical cannabis works within the state rule. And it does, because it is seen exactly the same as any other prescription that you would end up being prescribed by a doctor for any other condition. Which means that when you're taking that prescribed medicine, again, whether it's prescribed or not, that you would still have to be able to effectively perform the duties, right? Even when taking those prescribed medications. Ensure the safety of all employees. So you can't be under the influence to the point of not being able to be working in a safe environment. The rule says ensure the safety of all employees, the public, and property. It encourages, the rule says it encourages to take the use of leave when necessary. So if you feel like you're under the influence, what was the term you used for me? Impairment. Impaired. If you feel like you're impaired to the point where you can't do your job, well, that's why you can take, your own personal leave, or we can get you on FMLA or something else. But it does not, just because you're prescribed, whether it's medical cannabis or any other type of medication, just because you're prescribed that, it's still, you have to come to work with the ability to do the job and be safe. So it does prohibit the use of illegal or unauthorized use of a prescription drug. So if you're overusing based on what's prescribed, and you were asked to drug test, even though you were prescribed that medication, they would still be able to say, well, your use of that medication is over what the prescription is. So it has to be, you have to follow the prescription.
Hold on a second. They're saying both interpreters are interpreting at the same time.
They are.
All right, but will you have, I'll have them spotlight Clay then. I apologize. I came back from the break and I thought Paul just went off, but will you, Paul, you can go ahead and go off and then tell everybody to find me.
So Clay,
Yeah, Clay's interpreting. All right.
pretty good. So now let's talk about this, a unique situation now with drug testing, and that's teleworkers. So can we drug test a teleworker? Well, the one thing that we have not been able to do from a drug testing perspective is find a solution, a provider that will actually come into somebody's home and drug test them. So the answer is not that we can't, but we just don't have the capability at this time. So we are not drug testing teleworkers. And again, a lot of that has to do with safety, right? So you don't want to, if they're home and they're in their own environment, and safety isn't as big of an issue, but you also don't want to say, hey, why don't you go down to this drug testing location while we think you're under the influence and see how that works out, right? So you just want to be able to focus from a performance issue. And if you see performance issues, doesn't matter whether they're using any kind of illegal substances or if they're impaired, if they're not meeting performance expectations, then you end their telework. Just follow that process of what we're going to do, making sure that we follow the process of when to suspend telework. Okay. So we can terminate, according to rule, we can terminate somebody for refusing a drug test, for presenting an altered sample, or obviously if they test positive for any of the drugs or alcohol based on the levels that we're looking for. So those are that's the quick items on those are the quick items on drug testing, reasonable suspicion drug testing. Any questions, Armin, on drug testing?
Not at the moment.
Not at the moment.
Give you just a second here.
Yeah, so we're gonna give it a
We did have-
second. Any final Q&A on?
We did have one other question for FMLA, if you want to, Diane, if you want to come up.
Come on up, Diane.
Actually, it's not on FMLA, it's on parental leave.
Bill.
Same
Still
thing,
good.
still Diane.
It's still you.
It's still Diane.
You can keep this forever.
It's the passing the baton. That's so, now you talk and then you pass it back to me and I talk.
It's like the microphone.
So
Right.
the question is, must staff have worked for a full year to qualify for parental leave similar to with FMLA?
No, that is not a requirement.
In fact, one of the slides that Diane had with the leave codes had FMLA type parental leaves and non-FMLA type parental leaves.
See, you could just do that.
So yeah, so an employee is theoretically
Right.
eligible to receive the parental leave
Upon date of
from
hire.
day one.
Yep.
Postpartum and parental. I mean, they're
Correct.
used
Correct.
interchangeably,
Right.
right? Not used interchangeably. Yeah,
Yep.
yeah.
Okay, any other questions?
Yes, I have one for you.
This is great.
What about
Yes,
putting notes in of medical issues in UPM? What's your true thoughts
don't do it.
on that?
Don't ever do it. There's no need to put that in there. In my opinion, if you're saying someone is not meeting their percentage rates because they're off on approved leave, should have adjusted those rates because of their approved leave. There's no reason to make a note of that in their UPM that I am aware of.
So
But
as a
we should
recap,
talk about it.
no medical issues or details in
Right.
UPM, right? That's kind of the
Correct.
bottom line.
Correct.
And I'd throw it out kind of like we were talking before. If you have a specific question, the specific issue that you want to, bounce off of us, please feel free to
Please
do
just
so.
call.
Anything
Exit
else?
stage left.
No, I think
I'm not going to give you the remote.
no more questions. I don't need the remote because I'm not going to control those.
15 minutes
So,
early.
yeah, we're earlier. We targeted early and we're even going to be earlier. But all I wanted to just maybe end with here is just a reminder that Diane and Mark and I are always willing and ready and desirous to help you with navigating these issues. They are complicated. Often they require a very individualized assessment, and it's entirely possible that you could take two employees with two exact, or at least seemingly exact same scenarios, same symptoms, same issues, same requests, and one might have it granted and the other not. And it's an issue where it's best to just get us involved as quickly as possible so that we can help you navigate those. Mark and Diane are absolute experts on this. They have done this for a long time. They know what they're doing. I can't encourage you strongly enough to call them early on in the process so that they can help you make sure that these things happen properly.
Okay, two more. Great, awesome. So you're not here, so I'm just going to applaud Armin, Diane, and Mark. Thank them for their contributions and their efforts today. Two more quick housekeeping. This first one's going to sound weird because you're all present, but you can spread the word. All of the sessions that we've had, January through today and for the remainder of the year, they're always recorded. And we always make them available about a week after the session. So if you have a coworker, co-supervisor, someone on your team that needs to participate in this and they haven't yet, we will make it available. I'll send it out in an email in the next week or so, so you can go back and rewatch it. It's also there as a resource if there was something that you wanted to go back as a recap on any of the sessions. Also, once again, within the next week, you will get credit in the learning portal for having attended this because we are taking roll, but it will be necessary for you to give us just some quick feedback in order to complete that cycle of getting credit. Okay? Any other questions?
I don't think the questions, just a minute, we're going to send out to the DWS leadership, I'll email a series of some resources here that go with this, but that they can then have available to them. We'll probably send out these slides as well.
Yep, we'll send out the slides as well in case you think that might be helpful. Okay, thanks everyone. Appreciate you being here. Have a good afternoon.